Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. My name is Nitza Alvarez. I'm a board-certified cardiologist with a private practice that specializes in prevention, early detection, and the treatment of heart disease in women. My work has always been about helping women understand that our hearts are different. Yet, we've been moving in a system that often neglects us. When it comes to heart matters, women are under-recognized, under-diagnosed, and under-treated. Welcome to I Am You, the podcast where women learn how to protect the heart that carries them through every stage of life. Every episode, we talk about the real stories behind the science, because data matters, but stories remind us why it matters. Let me introduce you to Elena. She's 40 years old, teacher, mother of two, someone who juggles it all. One morning, she woke up feeling off. Her words came out slower. Her right hand felt heavy. She brushed it off, probably stressed. She told herself she would rest later after class, but the next week, as she stood in front of her students, she couldn't find the right words at all. Her colleague noticed, she called for help, and minutes later, Elena was in the emergency room diagnosed with a stroke. Now, I wish I could tell you this story is rare, but it's not. Women like Elena are showing up younger and younger, 40s, even late 30s, with brain events that used to belong to the elderly. Let's talk about what's happening. A stroke occurs when blood flow doesn't get to a part of a brain. There are two types of stroke, ischemic and hemorrhagic. Today, we're going to be focusing on ischemic because this one accounts for nearly 90% of all stroke. In an ischemic stroke, a vessel becomes blocked either by a clot or plaque buildup. Within minutes of the interruption of the flow, the brain cells begins to die. In the hemorrhagic stroke, that one occurs about 10% of the time. This one causes bleeding inside the brain. The word says it. It's Greek word, hem, blood, ragic is bursting. So there's blood coming out of the vessels, bursting out. This happens when a weakened artery ruptures, causing bleeding into the brain. Both can cause lasting disability or death, but as I said today, we'll focus on ischemic stroke because this is where women biology play a hidden role. Here's what the data tell us. Stroke is the fifth leading cause of death in the United States and the number one cause of long-term disability. Each year, about 750,000 people experience a stroke, and women account for more than half of those cases. But the most alarming trend, we are seeing stroke happen earlier in women, especially during their 40s and 50s, a time when most don't think they are at risk yet. Recent analysis from Stroke and Circulation Journal show that stroke rates among women between the ages of 45 to 54 are climbing. Why is this? The answer is our hormones. Because risk doesn't begin at 70 or 80. It begins silently during perimenopause when hormones begins to shift. Our hormones are more than for just having babies. And that's what I want you to take with you at the end of this podcast. For decades, medicine treated estrogen as a reproductive hormone, and that was a mistake. Estrogen is a vascular guardian. It helps blood vessels stay flexible. It stimulates nitric oxide, which is what keeps the vessel open and responsive. And it maintains a delicate balance in how our blood clots and how our arteries heal after injury. When estrogen levels start to go down in perimenopause, the endothelium, which is that smooth inner lining of our arteries, become less active. The endothelium is a living organ. It's not like a wall in the house. When estrogen goes down, blood gets a little thicker, vessels get stiffer, and the brain circulation is less adaptable. Think of it like a river. Before menopause, the river runs clear, is strong, smooth current, and as estrogen declines, that rivers become shallow and slow, and when the flow weakens enough, a clot can form. A recent study published in Stroke magazine last year showed that cerebral blood flow drops by nearly 20% during menopause. 20%. We're talking about greater than 10 years before our last menstrual period. That drop in blood flow is linked to early white matters. Listen to this. This is what neurologists call white matter hyperintensities, or sometimes is being referred as mini strokes. On some patients, when they go for a head CT, for something else, and now the doctor is telling them that there are mini stroke in the CT, but the patient didn't notice anything, those are tiny areas of damage, invisible in daily life, but predictive of stroke and dementia later on. This means the process begins long before the first major event. By the time a woman reaches her 50s, the groundwork might already be there. The risks become even greater for two groups of women. Listen, just in case you belong to these groups. First is those who enter menopause before the age of 50. If that is you, your risk of stroke is about twice as high as women who reach menopause later. Second group is the women who lose estrogen abruptly. For example, after having their ovaries removed or following chemotherapy, which is often the case in breast cancer survivors. But the story doesn't end there. While stroke incidence overall has fallen over the last 2 decades, stroke in younger women is actually increasing. Here is an interesting fact. Although the risk for stroke in men and women is equal after menopause, before the age of 45, women have more strokes than men. You might be wondering, what's really driving this? Let's go through the main risk factors for stroke together. And as I mentioned each one, take a moment to do a quick self-check. Ask yourself, does this apply to me? Because understanding your own risk is the first step toward prevention. We will start with the most common ones, high blood pressure or hypertension. It is the number one cause of stroke in both men and women, and it often goes unnoticed until it is too late. Number 2, risk factor number 2, diabetes or prediabetes. High blood sugar damages the inner lining of your blood vessels and accelerates plaque formation. But here's where it gets interesting, because those are not the only risk. Women, especially younger women, often have what we call non-traditional risk factors, things that don't always show up on a routine screening but can still lead to stroke. Here are a few to pay attention to. Hormonal shifts, whether from perimenopause, pregnancy, or because of the use of contraception. These changes can alter your blood pressure, your clotting factors, and the way your blood vessels respond. Migraines, particularly those that come with visual auras, they're not just headaches. They can be a sign of vascular sensitivity. Autoimmune or inflammatory diseases such as lupus or antiphospholipid syndrome, which increase clotting factors. And finally, a patent foramen ovale, or what is also known as PFO, a small opening between the chambers of the heart. This is not unique to women, but it's an important and often overlooked cause of stroke in younger patients because it allows tiny clots to slip through and travel to the brain. So as you listen, think about where you fit in this picture. Maybe you recognize one or two or several of these factors. That awareness is the moment prevention begins. So when a woman like Elena shows up at the hospital, she will most likely be told that she is stressed. After all, she's too young to be having a stroke. I am here to tell you that we better think twice before accepting this as our diagnosis, because sometimes stress is your brain whispering that the circulation has changed, that is struggling to keep up with hormonal loss, microvascular stiffness, or an unrecognized clot source. And this is the window where we can make the biggest difference if we know what to look for. Now, if you are interested in understanding the science, the myth, and minimum evaluation that women should go if we suspect that they have a stroke or a mini stroke, please join me on the next episode of I Am You, where we will be discussing this topic. I am Dr. Nitza Alvarez, and this has been I Am You. the podcast where women learn how to protect the heart and the brain that carries them through every stage of life. Until next time, take care of your heart, listen to your body, and remember, you are your best medicine. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD, NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.